Hi there. My name is Scott Yaris from Stuttering Therapy Resources. I'm here to share with you some thoughts about another of the strategies that we use in therapy in order to help to enhance children's fluency and communication. In this video, I'm going to focus on the needs of young children, preschool children, young school-age children who are close to the onset of stuttering, approximately age 2.5 or 3, up to age 4, 5, and maybe 6, but not much older than that. The technique I want to describe today is something that we might refer to as easy talking. The goal of easy talking is to help to reduce time pressures in a child's environment. I want to highlight that when I talk about reducing time pressures, I do not mean that parents or others are intentionally putting time pressures on a child or in some way causing him to stutter. I'm talking about instead the fact that for some children, if they are in an environment in which the pace of conversation is higher, typical though, but higher. And if they try to keep up with that, they may have difficulty doing that. And for some children, that difficulty may well result in increased stuttering disfluencies. So the first thing that we do before we introduce this strategy is we look to make sure that the child might be likely to benefit from it. In other words, we're going to first have to assess whether easy talking as a strategy for the parents is even relevant for a particular child. It may not be. If you're working with a family where the overall pace of communication is low, where the overall pace of communication is appropriate for a young child, then you don't need to slow people down any further if they're already giving the child the time that he needs to talk. But many times, if people are engaging in a normal adult-like or older school-age child-like pace of conversation, that can be harder for very young children to keep up with. So always, with any strategy, first make sure that it makes sense to do it before you introduce it. For those situations, then, when it does make sense to do it, we can introduce easy talking as a communication modification that parents and other caregivers can use in order to help reduce the child's sense of needing to rush. Again, the parents aren't doing anything wrong, but if the child feels like he needs to rush, well, no matter what the thing is that he's doing, if he feels like he needs to do it more quickly, it's going to be harder for him to do it successfully. And that's all we're looking for here with easy talking. Now, that was a whole lot of words to basically say that I'm talking about a strategy in which we ask parents or other caregivers to talk a little bit more slowly to the child. So why didn't I just say that? Why didn't I just say, let's talk about slow talking? Because my goal here is not specifically for the parents to talk more slowly. There are many, many different approaches out there in which parents are asked to speak more slowly. And one of the challenges that we see with those approaches is that very often they result in less natural sounding speech. So what I want you to do is I want you to take any approach that you've ever heard of in which parents are taught to stretch out their sounds or to talk particularly slowly or to chain their words together or anything that is unnatural sounding. I want you to set those aside. That's not what I'm going to be asking parents to do. And there's a very simple reason for it. When we ask people to use unnatural sounding speech patterns, it is very difficult for them to maintain those different speech patterns. And if we've asked the parents to slow their rate of speech and to use something dramatically slowed or stretched out or sing-songy, it's going to be hard for them to maintain. And if they don't maintain it, but they feel like that's what they're supposed to do in order to help their child, well, then they're going to feel guilty. They're going to feel like they've done something to cause their child to have greater difficulty. And I never want to increase parents' feelings of guilt about their child's speech. We know parents don't cause stuttering. Of course, the environment that a child is in can play a role in the child's experience of stuttering, but I don't want the parents feeling like they must have caused it by talking too fast. So, I don't tell parents that they've done anything wrong. In fact, I tell them that they haven't. I don't tell them that they're going too fast, that they need to slow down, but instead we talk about how the child may be perceiving time pressures that cause him to feel like he wants to rush. And while he wants to rush, that may make it harder for him to maintain fluency. So, not just slow speech. I call it easy talking as opposed to some other things because I want the parents to think about this as an overall style of interaction, not just speaking slowly, but between slowing just a little bit and increasing the pauses that they use between groups of words. For example, between phrases. You may have noticed that just now I switched from my normal, typical, everyday, faster rate of speech to an overall style of interaction in which I'm leaving more pauses between groups of words and slightly longer pauses. You may have noticed that just me doing that reduces the overall pace, the overall driving speed of the interaction. And you may have noticed that it still sounds natural. It doesn't sound like I am doing something atypical in my speech. I'm not doing anything that would necessarily draw attention to my speech. I've just left a little bit more time for the child to hear what I've said, to process what I've said, and to formulate his own response without feeling like he needs to rush. Now, a lot of people will introduce a style of speaking like this as so-called turtle speech, okay? And I don't have anything wrong with turtles. I mean, I love turtles. In fact, I've always got turtles around me somehow. I've got a jade turtle sitting right here on my shelf. It has nothing to do with the speech thing. It's just that I like turtles. I've raised turtles since I was a boy, okay? But turtle speech is often presented to parents as a really slow way of speaking. And that's not what I'm after here. What I'm after instead is more like the model that Fred Rogers used in Mr. Rogers' Neighborhood. If you've watched Mr. Rogers recently, you know that, yeah, maybe he does speak a little bit more slowly, but not an unnaturally slow rate of speech. It's not sing-songy or stretched out. And what he does in particular is he pauses between groups of words to allow the listener, the television audience in that case, time to understand what he said. That reduces the sensation of time pressure. It reduces the feeling that the child needs to rush. And that, in turn, can help to facilitate the child's production of more fluent speech. Now, I want to emphasize something. At the early stages of therapy, when we're first introducing this easy talking approach to parents and other caregivers, I am not yet expecting the child to slow down his own speech. For a long time, we thought that was the reason. We thought that we would have parents slow down their speech so that the children would slow down their own speech and thereby become more fluent. But lots of research conducted in the 1980s and the 1990s showed that that's not how this works. When a parent slows, the child does not also slow. The child does tend to become more fluent, but not through the mechanism of dramatically slowing his own speech. I think the mechanism at play here is simply the reduction in time pressure. Now, there may come a time later in therapy if we need to move toward more direct treatment for a particular child. There may come a time when we would want the child to change his own speaking style, maybe a little slower, maybe some pauses between groups of words, fine. But for right now, in the early days, easy talking is just a strategy that we want the parents to use. And it's not even the specific rate of speech that we're all that concerned about. It's simply the reduction in time pressure that the child may perceive. When parents learn that they can use a slightly slower rate of speech with slight pauses between groups of words in an attempt to reduce time pressures, that can make it easier for the child to take the time that he needs in order to formulate and express his own thoughts. For now, that's all we're looking for. And what I'm demonstrating right now is what I use for easy talking. I don't tend to call it slow talking, as I mentioned, because I don't really want parents to focus on the rate. I want them instead to talk about an overall easier interaction style with the child. Slightly slower, slight pauses between groups of words, and other changes that we might well make in order to reduce overall time pressures. I'll address those in another video in the future, but for right now, when you think about easy talking, just think about that easier interaction style while still maintaining the naturalness of your own speech and of the parent's speech, and and setting a stage for the child to experience increased fluency through this facilitation of his communication. There's a lot more to say about easy talking. There's a lot more to say about other strategies for helping young children who stutter to improve their fluency. Those are addressed in great detail in our book from Stuttering Therapy Resources that I wrote with Nina Reardon Reeves. It is Early Childhood Stuttering Therapy, a Practical Guide, and you can find it at www.stutteringtherapyresources.com. Thanks for listening to this video, and I will have more for you before too much longer.